All right, that's the title of the talk. It's the topic that we were asked to talk about. And it's very simple. It's the ability of the lungs and the respiratory system to function efficiently. All right. So before we talk about respiratory health, I'm just going to give a primer, and apologies if everybody knows this already. Okay. Like, what do the lungs do? All right. And what is the respiratory system for? All right. Because that's going to help understand how to explain when things go wrong and what to do about it. All right. So the lungs, all right? We're going to talk about the lungs. The respiratory system actually begins here in your face, all right? It's your nose, it's your mouth, it's your throat, it's your trachea, it's your lungs, it's all of the blood vessels around your lungs, okay? So as you see, in any system in the body that is really well protected, like your brain, protected by the skull, your lungs and heart protected by the ribs, mean that without those systems, you cannot survive. All right. So the purpose of the lungs is to exchange oxygen. All right. Bring oxygen into your body, take carbon dioxide out of your body. All right. Oxygen is what is required for your body to make energy and to operate. All right. Carbon dioxide is basically the waste product of all of the metabolism that your body does over time, every second of every living moment of your life. All right. And if carbon dioxide builds up in your system, you have very big problems. And so breathing in brings in oxygen, breathing out releases carbon dioxide. Very important, right? You do this 20,000 times a day. All right. 20,000 times a day. All right. And I just want to tell you about the different pieces of your lungs, because different problems affect different pieces. So the first, the big tube is here. It's called your trachea. And again, anytime something is protected in your body, it's important, right? So your trachea is protected by cartilage, right? Those are the hard pieces that you feel when you touch this, right? Then it goes into the bronchi, right? Then the bronchioles, and then the alveoli, all right? The alveoli is where the work of respiration happens. Basically, that's where oxygen goes from the air into your blood, all right? And it's where carbon dioxide goes from your blood into your air spaces. And there's two things that are really critical that I want you to think about, all right? You have 600 to 700 million alveoli per lung, okay? And what that means, these are tiny little balls. If you think about the branches of a tree, imagine the end branches having millions of tiny little balls. That's where oxygen is exchanged and carbon dioxide is gotten rid of, all right? If you were to take one human being's alveoli and spread them all out, open them up and spread them out, it's about, each person has the surface area that you would have in a tennis court, 10 by 10 meters, about 100 meters squared, all right? The other thing that matters is your diaphragm. This is a muscle right underneath your lungs that automatically works, sort of like your heart automatically works, to just go down, and when it goes down, you breathe in, and when it goes up, you breathe out, all right? And so, two things, the two main things the lung does: delivering oxygen and removing carbon dioxide. But there's one other really important thing, all right? Your lungs are one of the most important defenses against infection, all right? And so the reason you have hair in your nose, all right, is because that hair in your nose is the first defense to filter out dirt and particles and some infectious agents, all right? Bacteria, viruses, etc. All right? And so your lungs are doing, let's think about your lungs as doing three things: delivering oxygen, getting rid of carbon dioxide, and first line of defense against things you don't want inside your lungs. All right? Now, when you breathe in, again, sorry if this is rudimentary, but what is also happening is you are moisturizing the air. You're moisturizing the air. So you're making the air moist so that every time you breathe in, you don't dry out those alveoli. all right? And the trade happens, oxygen goes into the blood, carbon dioxide goes out, and you expel all of that carbon dioxide. So what can go wrong in a system like that, all right? The main things that can go wrong, all right? Upper respiratory tract. Upper respiratory tract is your oral cavity, your sinuses, your throat, okay? Upper respiratory tract infections. Anything that's not inside the lungs, right? That's the common cold, that's the flu, that's the sore throat, that's sinusitis. All of these things are typically caused by viruses, all right? Now, allergies, right? Allergies, an allergy is your body's abnormal response to some environmental thing, right? So if it's pollen, if it's food, that's what an allergy is, all right? And so what happens in an allergy, especially the seasonal allergies that we suffer from, I definitely suffer from seasonal allergies, is that your body has an abnormal response and swells up, right? And that can have an impact on your respiratory health, because if you're not able to get air through your nasal cavities, right, then you're struggling, all right? Now, upper respiratory tract infections and allergies can be miserable, but they're not dangerous, okay? Now, from a respiratory perspective, where things get dangerous is lower respiratory tract infections. This includes pneumonia, TB, sequela of COVID-19 as we live through, right? Asthma is also something that happens in the lower respiratory tract and can be very dangerous. And just to give you a sense, the common cold, for instance, in many countries, the number one reason that a human being goes to see a doctor, all right? And asthma, I think the chat is open for everybody. And so I have a question for you. What proportion of Kenyans do you think have asthma? Or even better yet, just write in the chat, how many Kenyans do you think suffer from asthma? Just average. 1 million, 4 million, 10 million, or 500,000? Give me some votes. I'll wait about 5 seconds and then give the answer if people don't want to write in. All right. 10% of Kenyans, about 10% of Kenyans, 4 million people in Kenya suffer from asthma, right? 4 million people. Moi, thank you for being brave. It's not as bad as you're saying, except that, Moi, in cities, the incidence of asthma, especially in children, is much higher and can approach 20-25%. All right? Okay, we'll get to asthma as a topic in and of itself, right? But right now, let's talk about the two other respiratory conditions that we're not going to talk about today, okay? Chronic obstructive pulmonary disease, which is typically about 70% of people with this condition are smokers, all right? Remember I said that all of the exchange of oxygen happens in those little balls at the end of your lungs, which are reflected in these red grape-like clusters in the image here, right? What happens with obstructive pulmonary disease is the walls of those alveoli, they're called, those little balls, get destroyed. And when they get destroyed, that means you have less surface area to exchange. And so the amount of area goes from a tennis court, 10 by 10, to exchange oxygen and get rid of carbon dioxide, to maybe 2 by 2 or 4 by 4. You can imagine that if you have, or more than have, the amount of oxygen you're able to exchange and carbon dioxide you're able to get rid of, things don't go well, right? And then last but not least, lung cancer is something that people think a lot about and are worried about. We're not going to talk about it today, but there are other really important respiratory conditions that hopefully another time we'll get a chance to talk about. All right. So typically, right, what do you do? What is breathing, right? Breathing is in and out. And so the symptoms that you have when anything is wrong with your lungs typically could be a cough, right? Or a wheeze, or difficulty breathing, or catching your breath, chest pain or discomfort, and excess mucus production, meaning that like things are just, you're just producing all sorts of fluids and they're, coming out in ways that, are not pleasant. And so anytime this happens, any one of these 4 or 5 things happen, something's going on with your respiratory system, all right? All right. And so let's talk about the most common. So even in Kenya, the common cold is the #1 reason people seek medical care, all right? Unfortunately, an upper respiratory tract infection, that is an infection that is affecting any part of your oropharynx, your mouth, your nasal passages, your throat, up to inside your lungs, typically caused by a virus and usually caused by one of 200 strains of different viruses, all right? And super contagious, all right? And not contained, I want to just say this out loud because there's some myths around here. The viruses that cause the common cold, all right, are not present in saliva. They're present in mucus, but not saliva, all right? And so what do you get with a common cold? You get misery, all right? Runny, stuffy nose, sneezing, coughing, sore throat, and mild fatigue, all right? Now, influenza and the common cold can look very similar. Some of the differences, it's not all the time, some of the differences is that usually with influenza, you've got much more severe symptoms, you have high fever, your body aches, and people are exhausted, okay? So it's not black and white, but if you're trying to figure out whether, you've got a regular cold or the flu, really the symptoms you're feeling can help you figure that out. The big difference is that the flu can progress into a lower respiratory tract infection, all right? And the common cold usually does not, all right? Sinusitis, you have these sinuses, they're here, okay? And fluid has to drain freely out of those sinuses. Sometimes you get an infection or a blockage, and that can cause an enormous amount of face pressure and head pressure, and that's what a sinusitis is. And so if you've got terrible discharge and facial pain or frontal pain, you have to think about a sinusitis, all right? Pharyngitis, sore throat, some things can be, usually sore throats are from a virus, which are, again, not treated by antibiotics, and sometimes they are due to something called streptococcal pneumonia, right? Which is a bacteria, and you need to treat with antibiotics. Tonsillitis, typically we think of tonsillitis as something that happens to children. Tonsillitis can be infectious, meaning there's a virus, sometimes a bacteria causing it, or it can be just inflammation of the tonsils, all right? And the problem with tonsillitis in children, and the reason so many children get their tonsils and what are called adenoids taken out, is that your tonsils and adenoids actually respond to other infections. And so they get bigger when you're having, when you have a cold or when you have a pharyngitis, and when they get bigger, they can make it really difficult for people with small passages to breathe, right? And so I'm a pediatrician, I see this all the time. And so the tonsils are not actually essential, and they usually, in adults, they disappear, all right? And so kids that have lots of episodes of tonsillitis actually have a much easier time if they get their tonsils taken out, which is why we take their tonsils out. And then COVID-19 is something that we lived through for so many years, all right? I'm not going to focus on today, but happy to do a talk on COVID-19. Now, let's get to the common cold, all right? Common cold. Harmless, self-limited, 200 different strains of viruses cause the common cold, all right? And it is the most frequent cause of acute, meaning, visits that are due to a new event for people in the world, okay? On average, adults have 2 to 4 colds per year, all right? Kids have 6 to 8 colds per year, all right? And things that matter in terms of how many colds you're going to have every year. Age, the older we get, the more susceptible we are. The younger we are, the more susceptible we are. Whether your immunity is normal or having compromised, and how much exposure do you have to people who are sick? All right, those are the things that determine. So obviously, pediatricians, parents, and teachers get more colds than other people, right? In terms of adults, and kids get lots of colds because they're surrounded by other kids that have colds all day long, and they certainly, for the most part, don't take the kind of precautions that parents would: distancing, washing your hands carefully, etc. And so kids get, two times as many colds on average as adults. All right, how can it spread? So hand contact. So typically you are touching your face, you are rubbing your nose, your eyes, etc. Virus goes on your hand, you shake somebody else's hand, or you open a door with that hand and somebody else, right? So hand spread. That's how colds can be spread. The viruses that cause cold can be spread, small and large puddle droplets. So when you sneeze or cough, the viruses are in the air. Somebody breathes them in, or they go into the eyes, or they're contaminated. Similar to COVID, just not as infectious. And so, what if you got a cold, stuffy, running nose, sneezing, sore throat, cough, low-grade fever? All right, very important here is low-grade fever. Headache and malaise just sort of feel terrible. And so let me ask you, I've got a bunch of myths, all right? And I wanted to ask you what's true and what's not, all right? So we talked about what causes colds, a virus, right? In the chat, just a question for you. Oh, sorry, I'm just seeing chats right now. Are you not able to hear me? Hello?
We can hear you. We can hear you, Dr. Keba. I think
okay.
it's connectivity issues from their end. Yeah, but we can hear you, and the presentation is okay.
Okay. So does cold weather cause the common cold? Yes or no? Just write in the chat if you think yes, if you think no. Does cold weather cause the common cold? Yes, no, we've got a tie. All right. All right. So I'll break the tie here. All right. So cold weather by itself does not cause a cold, right? So if you walk out into a freezing place, it's not the cold that's going to cause a cold, right? It's not the cold air or the cold temperature that's going to cause the common cold. Because again, please remember, common cold is caused by a virus. That means the virus has to come into your system, infect your cells, and cause symptoms, right? One of the reasons that people have many more colds when it is cold outside is that when it's cold outside, people spend a lot more time inside, okay? And in close contact inside. And so spread of those viruses happens more frequently. But the act of going outside, and we'll talk about a couple of exceptions, they don't cause the cold, but they can cause cough, is not predisposing you to having a cold, okay? It's always the virus that causes the cold. So the next one is sort of giving the answer away. If you have a cold, meaning you have a cough and you feel terrible and you've got a runny nose altering with a stuffy nose, should you be taking antibiotics, and are those antibiotics going to help you? Do antibiotics help you if you have a cold? Are you sure, folks? I'm seeing no, no, no. Why does everybody get antibiotics when you go to the doctor for a cold then? So you are right. Antibiotics do not cure. The biot means bacteria, antibacterial, right? So antibiotics do not cure the common cold, but they can hurt. because every medicine you take has side effects, all right? So if you have a common cold, antibiotics should not be taken, all right? And we'll talk about what happens when your common cold goes to something that you might need antibiotics for. Okay, so vitamin C, does it work? Does vitamin C prevent colds? Yes, yes, yes. It helps, it helps, it helps. All right, so the vitamin C industry has done an incredible job marketing, all right? If you look at the studies, right, if you look at the studies, there is slight evidence that vitamin C may, and there's evidence on both sides, but there's people that believe that vitamin C may reduce the amount of time to recovery, but that vitamin C by itself does not help prevent a cold, all right? A balanced diet across the board will make sure that your immune system is up to snuff, and that might help protect you from a cold. But taking vitamin C by itself has never been shown to prevent colds, all right? So this is not saying don't take vitamin C, but just take it knowing that it doesn't have the preventive impact that we, in public lore, we think it does. Although when you get a cold, it might reduce the amount of time that it takes to recover. Okay, next one. We see our kids going out in the wintertime with wet hair. We say, hey, dry your hair. Can you catch a cold? Can you get a common cold from wet hair? All right. I'm seeing many more no's, okay? And so that makes me happy because, again, wet hair has nothing to do with the virus, all right? And the virus is what causes a cold, all right? And so there are lots of reasons to not go out in the cold with wet hair, especially if it's cold enough that your hair might freeze. It's definitely happened to me, but not because you don't want to catch a cold, okay? Now, green mucus versus white mucus versus yellow mucus. Is there a difference? And if you have green mucus coming out of your nose, all right, or you're coughing green mucus, does that mean you need antibiotics? All right. So this is another myth, okay? Just want to be super, the color of your mucus means nothing in terms of whether it is bacterial or viral, okay? And so just because you have a cold and your mucus is green and sort of gross, doesn't mean you need antibiotics, because antibiotics are for a bacterial infection, and with a viral infection, you can have green mucus, okay? So really what we need to think about is what are the things that are not normal in a cold, okay? I'm catching your questions and we'll answer all of them when we close, okay? And so most common colds last 7 to 10 days. And a lot of them start with a little tickle in your throat, and then the virus gets to work inside your tissues, right? And then about 3 days later, you start feeling terrible, and the cough and the sneezing and the congestion, etc. Typically, then it takes about 3 to 5 days to get better. And most people are recovered from a common cold in 7 to 10 days, with the peak around 3 to 4 days. Okay, that recovery may take longer if you smoke. All right. The common theme here is everything is worse if you smoke. All right, in terms of your lungs. I'm seeing a hand. Alan, do you have a question? Okay, I'll keep going. Happy to take questions in the middle. And so the treatment, we've already established that common cold is not bacterial, so antibiotics don't work, right? But there are treatments for the common cold. All right. So mild symptoms. When don't you need symptoms? When don't you need treatment? It's, if you just have a little sore, stuffy nose or runny nose, a little bit of a sore throat, and just feel a little off. That you don't really need. You're going to get better by yourself because your incredible immune system is going to take care of it. If you've got moderate to severe symptoms, so meaning you really feel terrible, you're not able to do, you're in pain, you're having, it hurts when you breathe, it hurts when you cough. We've all been there, all right? Analgesics are important and are something that can help. Analgesics like paracetamol or Brufen can help relieve the headaches you have, the joint aches and muscle pain, okay? Totally fine to take those medicines because they can help people feel better, all right? Honey, cool, moist air, and cough suppressants if you're not able to sleep, all right? We don't typically prescribe cough suppressants unless the cough is preventing people from sleeping or the cough is preventing people from doing some important activity, all right? And there are a bunch of different cough suppressants that work pretty well, all right? Usually, we like to prescribe non-drowsy cough medicines because otherwise people are really tired and can't do the thing that they want to do, and that is the reason they're taking the cough suppressant. Okay, so this is really important because I've seen lots of prescriptions for antihistamines only. Okay, antihistamine with a decongestant, meaning something that reduces the size of the blood vessels, right? Which reduces the swelling, which answers one of the questions that I see asked here, which is when you have a cold, why does your nose run and get blocked? Why is it stuffy? Because when you have a cold, your body is responding to try to fight this virus. Okay, and part of that response is to bring cells to where the virus is and have those cells attack the virus and attack cells infected with the virus. That causes all sorts of stuff to be produced, and part of that stuff are chemicals that your body produces that cause your blood vessels to leak, all right, fluid, and that can explain some of the running and the stuffiness. And what happens is if you really are having a tough time breathing with your cold and you want to unblock and unclog your nose, or you want to stop the running, you take medicines that prevent the leakage and shrink the blood vessels so that they can't leak as much. All right, but it's the combination that works, because if you just get antihistamines like loratadine or sertrazine, etc., doesn't work. All right, and there's one warning I have for you. Nasal decongestants are great. These are sprays that you spray into your nose, and usually they constrict your blood vessels, making your blood vessels much smaller. Okay, don't use those for more than 3 days. All right, if you use those for more than 3 days, then when you stop them, your runny nose may get worse. Okay, doesn't work. We've talked about it. We've talked about these two things already, so I won't go over it again. Okay. Now, I've got a question for the group, and maybe Yvonne, you can help guide me here. I've got a section on how to manage upper respiratory tract infections for kids, as well as a section on asthma. Now, I'd love to go quickly through the management for kids, okay, and then focus a little bit on asthma. And again, happy to do another talk anytime on lower respiratory tract infection, okay? And so, infants 0 to 12 months, what do you do about a cold? All right, what do you do? Oh, sorry, I think I'm seeing a question here that that is answered in the slides, and the answer, here we go. We got danger signs, and we'll talk about what that looks like. So if you've got a kid from 0 to 12 months, what do you do about a cold? All right, keep the nasal passages clear. All right, because again, they have such small airways that if they're blocked up, it can be really hard and really uncomfortable to breathe. The way to do that is nasal saline, okay, to just gently moisturize their passages, ensure hydration, and maintain a comfortable environment, okay? So in 1 to 5-year-olds, get them to rest, let them sleep. Nasal saline drops or sprays in the nose help. Lots of fluids to stay hydrating. What works really well for these kids is going into the bathroom with hot water and just steaming. It helps sort of unclog the passages. Balanced diet is always important. Do not, in kids under age 5, this is important, it's not recommended by any pediatric association in the world. Over-the-counter cough and cold medicines in kids under age 5 are just not recommended because we can't prove that they help or even shorten the duration of the cold. And there are real side effects for any of those medicines. And so kids less than 5, we don't recommend, okay? If you're over 5, 6 to 12, again, this is when we can teach kids how to wash their hands properly, how to cough into their elbows, maybe wear a mask, obviously promoting a healthy lifestyle with diet and exercise. And in a kid that's over age 5, if they're having pain from their cough and that happens, you can use Brufen and Panadol to help with their sore throat, their fever, or their musculoskeletal pain that is driven through coughing. All right? What do you worry about? This is probably the most important. High fever. If your child has a high fever, if you think they have a cold, but they have a high fever, you want to seek care. Seeking medical care means you can call your virtual care doctor if you're an Antara member, right? And we will talk you through it. What is important with fevers is that when you sense a fever, you know how high it is, and you want to know the pattern of that fever, all right? If the cough is severe, so meaning if when they cough, they're having a difficult time breathing, okay? When they cough, they're wheezing or have chest pain, or that cough lasts more than 2 weeks, that's something you're going to want to talk to the doctor about, okay? If it's severe and they're having difficulty breathing, that requires immediate medical attention, all right? If they're breathing really fast or working hard to breathe, immediate medical attention, all right? Sometimes, because of the dynamics in the trachea and esophagus, meaning your vocal cords and your epiglottis, which protects kids who cough a lot, vomit, right? The cough stimulates the gag reflex causes the vomit, right? If your child is coughing then vomiting, and you're worried that they're not able to keep down enough liquids, please seek immediate medical attention. Other things you want to think about and worry about. If your child is pulling at the ear or they have stuff draining out of their ear, that means, because again, upper respiratory tract, it's not really the respiratory tract, but it's in the head, can be an ear infection. And you're going to want somebody to take a look at that ear, okay? If your child is complaining of severe headache or facial pain, you're going to want a doctor to take a look at it, okay? Because you're going to want to identify whether or not it's sinusitis or some other complication that can happen in children, right? If your usually energetic and alert child is really weak and lethargic and listless, immediate medical attention. And then if after 3 to 5 days, symptoms are getting worse instead of better, you're going to want to talk to somebody, all right? So those are the danger signs. Prevention, we all went through COVID. I won't go through this, all right? It's the same. Home remedies, all right? I just want to warn you about one thing, all right? There are things for sale that are called zinc intranasal preparations, all right? You basically spray zinc into your nose. Spraying zinc into your nose can cause permanent anosmia, which means permanent loss of smell, all right? So honey works, ginger garlic combinations, there's no evidence that they help or work, but they also don't hurt, okay? Keep warm, take warm fluids regularly, warm salty gargles. This is all symptomatic management, things that may make us feel better. They don't change the course of the cold, but they can make us feel better and well taken care of. The thing that I don't want you to take is zinc intranasal, all right? Get vaccinated, all right? You and the kids. And I mentioned influenza, all right? Great, there's some great questions. I'm going to get to them before we go to asthma. The kids that are over 6 months of age and older folks should get vaccinated against the flu. The reason you want to get vaccinated against the flu is because influenza can go from looking like a really bad cold to being really dangerous. And the people that are most susceptible for the progression to severe pneumonia all right, are children and older people, all right? And so if you have access to flu vaccination, if there's a flu vaccine drive, everybody should get it, all right? But especially kids over age 6 months and older folks. Pneumococcal vaccination. So all children in Kenya, I think since 2011, pneumococcal vaccination has been available. It is almost single-handedly responsible for the significant drop in hospitalizations in children for pneumonia. Okay, elderly also should have the pneumococcal vaccine. So make sure your parents have been vaccinated, make sure your children have been vaccinated. And obviously COVID-19 vaccine we lived through, all right? And so I'm gonna pause and just answer some of your questions here before we move to asthma, all right? So what causes continuous nose running? Is it an allergy? So it can be an allergy or it can be an infection, all right? So a question from Farah. If it's an allergy, what an allergy is, remember, is your body's abnormal response to environmental stimuli, to something in the environment, right? So your body might be responding to pollen in the air, and the way it responds to that pollen in the air for somebody with allergies is to get swollen, okay? And the thing that causes the swelling is your body releasing a chemical called histamine, okay? It's not supposed to do that, but people who have allergies, that happens. And so that's why the medicines you take are medicines that are typically medicines that prevent the release of histamine, counteract histamine, or prevent the cells that actually have the histamine to be released from releasing that histamine and coming to the place where they would do that, all right? If it's an infection and the infection is causing the runny nose, it's your body fighting the infection that causes the runny nose. So once your body wins that battle, the runny nose stops. Question, what is the problem when you produce brown mucus when you cough? There is no problem when you produce brown mucus. If the brown mucus looks like it has blood in it, then it is something that you want to take note of, all right? What are the key early warning signs of severe respiratory conditions? Key early warning signs of severe respiratory conditions are difficulty breathing, wheeze, shortness of breath, okay? Severe cough, blue lips, tingling in the fingers. What we call exercise intolerance. So not being able to do things that normally don't cause you to be short of breath. If those normal things like walking or walking up the stairs are making you short of breath, you've got something going on in your lungs. We've got to figure out what it is, all right? Question, which viruses cause the common cold and how do we get it? I think we talked about how we get it. The viruses that, as I said, there are about 200 strains. The most common virus that causes the common cold is called a rhinovirus, all right? But there are, again, 200 different viruses that cause the common cold. And so we're not going to go through all of them. We do not have a vaccine against the viruses that cause the common colds. We do have a vaccine against the influenza virus. It's a different vaccine every year because every year a different strain of influenza virus is the common reason that people get the flu. And so that's why every year people get a flu vaccine. All right. Are allergies hereditary or transferred? Allergies can be hereditary, or they can happen de novo, even in people that don't have a family history of allergies. Allergies are not transferred from individuals, right? But food allergies can be. You can have a family. If you have a family history of allergies, you can be more likely to have allergies. Different food allergies can be more prevalent in families, okay? But they're not transferred from one person to the other, right? Are there any respiratory conditions in children that makes them produce tears? There are not respiratory conditions, but the thing that most commonly causes the excess tearing is a narrow tear duct. It's something that can be treated. You should talk to somebody. And I'm not gonna answer the asthma question right now because we're gonna talk about asthma. All right. I hope I answered your questions on the common cold. Now let's get to asthma. As we said, 10% of adults, 10% of the population has asthma, 12 to 14% of kids, 2.5% of adults in urban areas have active asthma. Again, urban residents are more affected due to more pollution in the air, right? Now, asthma is the leading cause of chronic illness in Kenyan children, okay? And what I want to talk about, I want to talk relatively quickly because we are constrained with time, all right? Asthma in a nutshell, all right? Remember, I showed you what the lungs were. The lungs go trachea, big tube, bronchi, two big tubes, one going to the left, one going to the right, bronchioles, smaller tubes, and then your little sacs, the alveoli, right, where all the work is happening. Your bronchioles have muscles around them, all right? Now, what happens, remember I said asthma is like an allergy in that something triggers a reaction in the lungs that a person without asthma doesn't have. Now, that trigger results in three different things happening, all right? First, the muscles here, can you see? Oh, sorry. The muscles around your airway squeezes, all right? Normally, those muscles are not squeezing, but if you're having an asthma attack, those muscles squeeze, all right? Which means that the space in the tube that the air has to travel through gets smaller, right? Then the inside of the tube, which is where the air flows, all right, gets swollen, all right? And it gets swollen because your body's having this abnormal response to this environmental stimulus, right? And once it gets swollen, it then starts leaking fluid and cells. And so I want you to look at the size of the opening in the top image and the size of the opening in the bottom image. That's what's happening to your lungs when you're having an asthma attack, okay? Now, I want everybody to do what I'm doing right now. Go like this, right? Now, go with your mouth wide open. And now try to breathe through a really small opening in your lips, like this. See how much harder it is to breathe when the opening is small? Has anybody ever tried to drink water through a straw and pinch the straw a little bit? That's what happens to your lungs with asthma, okay? And so what ends up happening is you cough, cough, cough. You start wheezing because as you're trying to get air out, you're whistling. Basically, you're going, because the space that the air has to travel through has gone down, which is the wheeze. And then ultimately you have difficulty breathing because the space that air has to travel is so narrowed and you have to work so hard that it becomes hard to breathe. This is why asthma, if not treated, can be very, very dangerous, all right? So to treat asthma, we've got to take care of these three things. You've got to get the muscles to relax, you've got to reduce the swelling, and you've got to get rid of the fluid in the air spaces, all right? So what is it that causes asthma? Lots of things, okay? Allergens. Each person with asthma, each parent with a child that has asthma should learn their triggers, all right? That means allergens, which are pollen, dust mites, pet hair and pet saliva, mold, all right? Irritants, things that are pollution, tobacco smoke, car pollution, chemical fumes, strong odor, all right? And please remember, for those of you who smoke, cigarette smoke that is on your clothes can stimulate and trigger asthma, even if you don't smoke inside the house, all right? Please remember that. Respiratory infections. So the cold we were just talking about in somebody with asthma can be a trigger for their asthma, thereby complicating that cold, all right? There was a question in the chat, can my 5 a.m. walk trigger asthma? Yes, it can. If you are somebody that has something called exercise-induced asthma, or cold-induced asthma, right? Some people have a trigger in cold, dry air, okay? Then that can trigger your asthma. And there are things you can do. You can do a puff of a beta agonist right before you do physical activity to avoid having the asthma attack. And then, some people are very sensitive in terms of their lungs reactions to temperature change, and they can trigger asthmatic attack. Right. I want the reason I wanted to talk about asthma, right? And the reason I didn't have the slide on danger sides in asthma is I want to say this out loud. Okay. Asthma is absolutely manageable, right? But most people in Kenya that have asthma are not properly managed. Most people have a salbutamol inhaler and they use it very frequently, all right? Salbutamol doesn't treat asthma, okay? Salbutamol is the medicine that relaxes the muscles. Even if you relax the muscle, the swelling and the fluid is what is the real problem. And the swelling and the fluid can cause, over the long term, if not managed, real damage to your lungs, okay? So if you yourself or your child or spouse or parent or anybody you know is very frequently using the inhaler, the salbutamol inhaler, then that means that you are not properly managed for asthma, okay? And so I want to be really clear about that, because anybody who's frequently using their salbutamol inhaler needs different kinds of medicines to control their asthma, needs different kinds of medicines to reduce the swelling and fluid in their lungs, okay? And so what you need is everybody with asthma needs an assessment, needs to understand what the triggers are, right? And most importantly, everybody with asthma should have an asthma action plan, all right? And then a clinician or a team who's tracking and supporting you on an ongoing basis to figure out whether the treatment you're taking is working for the kind of asthma you have, all right? Now, there are a few danger signs. Now, occasionally I will pitch ourselves. What we do at Antara is every single person with asthma gets an assessment, gets an environmental assessment, gets their own personalized action plans, and we track very carefully, right? To make sure that your asthma does not become a problem, right? So what are the danger signs? What are the things you have to worry about if you or somebody you know has asthma? Difficulty breathing or rapid breathing, all right? Wheezing that gets worse. One of the things that we do a lot of, I've been doing a lot of this morning, is talking, all right? If somebody has difficulty speaking full sentences, that is an indication that their airways are closing up, all right? That is an indication that they're having a severe attack. So if you're talking to somebody and they're not able to get to the end of a sentence, right? We've seen it a lot. That is somebody that needs immediate attention, right? Chest tightness or pain, blue lips or fingernail, fatigue, lethargy, meaning tiredness or confusion, especially in older people, all right? And if the inhaler they have, the rescue inhaler they have, isn't helping, that means that somebody's got to be seen, all right? That person needs medical attention, all right? None of those things need to happen if you're properly managed, all right? And please note, most people are not properly managed. Most people have a rescue inhaler that they're using all the time. And rescue inhaler is in the name. It's only supposed to be used in very specific times, all right? I'm going to pause. We don't have time to go to lower respiratory tract infections today, but the overarching message here is, remember, 20,000 breaths a day, every single day of your long lives, mean that what goes in should be as healthy as possible. So avoid smoking, all right? And there are lots of smoking cessation programs and tools out there. So if you do smoke and would like to quit, then it's a great idea, all right? Exercise regularly, and that can mean walking. Stay hydrated, because staying hydrated is important for so many different reasons. Please get vaccinated. It makes a huge difference in the sort of how sick people get when they do get infections. And, you know, as COVID taught us, just practice good hygiene, because the simple act of washing hands regularly can significantly improve your life in terms of how frequently you're having infections. Folks, I am up against time, so much more to say, but I will answer the questions that have come in the chat before opening up the floor to any live questions. Is there, do early morning walks like 5 a.m. walk worsen asthma? They can if you have exercise-induced or cold-induced asthma. And so I'm happy to talk you through what to do about it if that's what you have. Why produce bloody mucus after brushing your teeth in the morning when you feel like you're clearing your throat? I think I need a little more information to answer that question, because I'm not sure if the blood is coming from vigorous toothbrushing and blood from the gums or from what you're coughing up. So I'll ask you to ask live or clarify. Allergens. Can we consider the CS gas or TS or tear gas as an allergen? Interesting question. Tear gas is something that has something called lacrimogen in it. It's an irritant, not an allergen. Although some people may have allergic reactions to it. I'm not aware that that's a big problem, but it's not an allergen per se. It is intended to irritate mucous membranes and create tears. So not an allergen per se. Is it okay to use Relvar inhalation powder for lung? It has fluticasone and furanate vilanterol. That is the kind of medication that is a combination medication for asthma that does what I was talking about, which is that helps relieve, that reduce the inflammation and reduce the fluid in the lungs, while at the same time it has what's called a long-acting beta agonist in it, which is the way that you treat people that are having frequent asthmatic symptoms. So it is okay to use. And if you get an asthma action plan and understand your triggers, and we'd be really happy to talk to you about this, then you can reduce the number of medications that you're taking over time. Is there a risk that asthma will get worse with age? Typically, asthma gets better through childhood, okay? But folks that have asthma in adulthood can get worse as they age, but there's no standardized pattern there, Shadrach. So unfortunately, I don't have a satisfying answer to you. Is it safe to use Montaget and Sertrazine on children when you experience severe cough during cold flu? So remember what I said, Sertrazine by itself, Sertrazine with decongestants can help, but shouldn't be using those medicines in kids under age 5, okay? Sertrazine by itself is not gonna help with a cold. It's not even gonna help with the symptoms of a common cold. And question, you exercise regularly, and then I'm gonna pause for a second and turn to Yvonne and see if you would like, how you would like to proceed. Is it safe? How would you recommend one treats a 3-year-old who's just joined kindergarten and just as you said, always has a runny nose, a cough, or both? I think, unfortunately, 6 to 8 times a year is the average, okay, of kids that are in school or communal settings. That feels like they always, so remember that is, out of 12 months in a year, in 8 of those months, potentially for 10 days every month, they're gonna be sick, and that's totally normal. They might have a cold. And so it feels like they are always sick, but it is typically within the normal range of what's going on, given that all of the other kids in that kindergarten, there is bound to be somebody that is sick. So that time period, age 1 to 5, is just a time period, especially if they're in nursery school or kindergarten, where they're just getting sick a lot, all right? If they are active and running around, not having difficulty breathing and just being themselves, then it's not something to worry about. Just try not to get it yourself. Yvonne, I'm gonna pause. There are a lot more questions, but we're at 2 minutes left. I just wanted to sort of end by saying that we at Antara would be the kind of both explanations and I hope approach that we've shown today. That's how we do healthcare in general, and everybody who is a member with us has all the time access to the kind of advice and information that I could give here or beyond. And we'd really be excited to sort of continue working with Liaison, because you're an amazing partner to support the folks on this call and the folks that they support. And so, Yvonne, I'm going to hand over back to you. And what I can do is I can save these questions and then answer them in writing, and you can send it out to the group. So I'm going to hand back over to you, Yvonne.
Thank you very much, Dr. Keba. I mean, we could go on and on. Yeah, so much to learn, and we have debunked a number of myths, and thank you for that very informative session. I just want to give one person who has a very pressing question to just raise their hand and ask just before we close up the session. One person who has a very pressing question. Yes, Joshua Mutunga, please go ahead, unmute and go ahead.
Thank you for giving me that chance. I just posted that the popular stuff they call dawa, does it just taste good, or does it have any value?
Oh, it's a great question. So, feeling good and taste good has value, inherent value. Okay. The thing that does have some sort of useful properties is actually honey. Okay, so honey is a natural antibiotic, but for some reason in coughs or
I'm losing you.
Dr. Keba, I think we have lost you there. I'm guessing that is a way of the webinar reminding us that we have come to the end of the session. But Joshua, because you had written your question on the chat, Daktari will answer it in full, and then you'll be able to follow the chat for your answer. I don't know if Daktari
Thank you so much. Thank you so much. Yeah.
Yes. So allow us to end the session here, but we will definitely answer the questions. So just follow the chats for those who've asked. And thank you very much for making time today. Looking forward to another session in the next month. Have a wonderful day. See you next time. You are free to leave the meeting. Thank you.